Hello and welcome to Natural Healing with Oriental Medicine. I'm Grant Boxleitner. I'm joined by Dr. Stephen Wrench of East West College of Natural Medicine. We're going to be discussing the ancient practice of cupping. Right now, though, I'd like to send it out to the president of East West College, Russell Badiata.
Thank you, Grant. Long before acupuncture, ancient Chinese culture embodied the practice of cupping. By placing a flame into an animal horn momentarily and then removing it, they created a vacuum between the horn and the skin. This was used over infected wounds to remove necrotic material. It was soon discovered that by placing the horns over areas of muscular pain and tension also helped reduce pain and facilitate the healing process. Over time, sections of bamboo were used, followed by clay jars, and today, clear glass.
Thanks, Russell, and we'll be checking back with you later when we see a demonstration of cupping. And Dr. Wrench, so we're off and running here on this show. The ancient art of cupping, what exactly is it?
Well, as Russ described briefly there at the opening, cupping is an ancient practice of applying small glass jars, and I'm going to show you a small one now, and you'll see these later in the program with Dr.
They look like
Fuller
small fish bowls almost.
It sort of does, doesn't it? But it's the application of this to the surface of the skin by way of a vacuum. So what happens is we apply these with a little flame inserted into, which again you'll see, this creates what we call a negative pressure or a suction. We apply it to the skin and it creates a vacuum. We can either leave it stationary or we can move this back and forth. And what it does is it moves or invigorates the flow of blood in the body.
Does it pull more blood there, or?
It does, exactly. If you can imagine receiving a massage, when we think about a massage, there's a lot of pressing in, pressing down, but in this type of moving cupping, we might create what we would call a massage in outer space, where you're almost in a zero gravity environment. So what cupping does is pull up or lift up on the tissues and pull them away, encourages the flow of blood into the region, and breaks up what we call stagnation.
So it's like a glass suction cup?
It actually is. It's a very simple concept that's been around for literally thousands of years.
Now, how did this practice of cupping come about then? You said it's been around for thousands of years.
Well, we can only surmise that we know through some written history what happened. And what happened was that somebody had to be the first to do all these great firsts that we had. We wonder, how did they come about this? So we're kind of a little bit of guesswork here, but somebody figured out that placing a flame in an airtight container, which by the way at the time was an animal horn, by placing a flame in the horn and then removing it and placing it on the skin, they figured out by creating a suction that they could remove harmful toxins from the body or say pus from an infected wound. This became quite effective and became a normal practice of medicine in that time. I might mention too that as far back as 1500 years BC, there are historical records that indicate that the ancient Egyptians actually practiced bloodletting and the application of animal horns over these little incisions or puncture wounds into the skin.
So these can be put over wounds or closed skin or both?
We wouldn't put a cup over a wound as much today as they did then, because we have other methods.
So this was the genesis of it. It was
absolutely
over wounds.
We don't. What we would do with cupping is apply it on the skin for the purpose of, as we said, to invigorate blood flow and to move it to create more supple tissues. When tissues are blood starved, we call this ischemic. Literally, there's not enough blood in the area. Think of muscle tissue, if you will, Grant, like a sponge that's not been in water for 24 hours.
Right.
We dip it back into the water, and all of a sudden it's soft and pliable and supple.
Gets invigorated.
Exactly. Not unlike a muscle tissue, it becomes hypertonic and it gets a little taut. So by encouraging blood flow, and another thing, as I indicated, we could move the cup as long as we maintain the vacuum back and forth. And this is our massage in outer space, if you will. Now, when they went from animal horns, they progressed into bamboo sections in ancient China, and this is recorded about 252 years AD.
Okay.
And now then it became like a clay, like pottery was used.
So pottery, and then eventually, now in China, do they still use glass, or did they graduate to glass, or is this a Western practice of the glass?
So clear glass, once it became available, I think everyone everywhere in the world, and I might mention, by the way, in the Middle East, cupping was big thousands of years ago. All across Europe, it was very big.
What did they use?
Probably bamboo sections or the pottery, as we talk about, little clay pots and so on.
Now, do you have some of the clay pots still from the historical perspective at the college?
No, we don't. This is the glass, although we have it in different sizes. I just showed you a small. Here would be like a medium. And these are size variations for, obviously, for placing them on large areas on, say, the upper back. Maybe the small of the back, maybe small ones
around. Or like
around,
a large leg muscle or something?
Exactly. Maybe around the shoulder area or something like this. So we even go much smaller in some of the cups here. I'll just give you a little heads up. I don't think you'll see this done later in the program. So here's another kind of cup that we would use.
Well, that looks almost like a bell of some kind.
It does look like, it's about the size of an oversized thimble. And this is a little pump that creates a vacuum. So we would plug this in, and I'll just place it, if I may, on the palm of my hand and see if I can get a suction. Probably not with this little one. I might, if I can remove it and not pull it off.
Now, does it pull the skin up when you're getting the suction?
You can, if you can see my hand. I'll try to bring it up.
I do see that.
And as long as that holds there, if I move, it'll fall off. But this creates a suction whereby a flame is not needed. So you can actually do this to certain areas of your own body.
So is this for maintenance, or is this for healing, or both?
Well, that's a great question. I think first and foremost, we'd say that it's for healing. When someone comes in and they have a chronic low back pain or an acute injury of some kind, cupping may be employed. But one good thing to know about cupping is you don't need a reason to do it. I will tell you that in ancient times, as today, when somebody has a cold, there are points on your upper back, and you might understand this clearly because of the location of where the lungs are, that it's common to do cupping on the back when a person has a chronic cough or is coughing up a lot of phlegm. And we'll put cups, maybe the bigger ones, maybe on either side of the spine. So just about upper back, we'd have 2, 4, 6 cups going down, just kind of coinciding with where the lungs are. That patient generally the next day will start to expectorate all this phlegm. They'll start coughing it up, and then as if the body is sloughing off this pathogen and this mucus in effect. And so what we can do is speed up the healing a bit.
Absolutely. We'll continue that conversation, but don't go away. When we come back, more questions with Dr. Wrench, and then we'll go out to the college to see an example of cupping.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back to Natural Healing with Oriental Medicine. I'm joined by Dr. Wrench, and we've been talking about cupping. And I wanted to ask you, what are the benefits of this practice?
Well, we touched on it briefly, but I'd like to kind of reiterate that for colds and flus and coughs and things like this,
yeah, you were making a good point
years,
about the phlegm and producing that and ridding folks of some of the symptoms.
But I think one of the primary function of cupping, Grant, is the movement of blood and the softening of hypertonic tissues that are almost becoming a little rigid because they're, as we said, they're blood starved. So for athletes and things, or for people in general, if you live an active lifestyle, I mean, who doesn't have an ache and a pain somewhere in the course of their day? So for this, it would be a great idea as to serve as a maintenance program. So, but if you're, let's say you're doing yard work, you're working out at the gym, you're taking a yoga class and so on, if you got life's little aches and pains and these little reoccurring
Just a little nagging soreness.
Absolutely. Then cupping something you should do, and I would mention at this point too, should be done by someone who knows what they're doing, because as we'll see in a moment, you could cause harm with this. You have to be careful. You have to be sure where you're doing it, when not to do it, and so on, which we'll talk about momentarily. But this is something that is good. It's not inappropriate for anyone if it's done properly. Yeah,
and that's the one thing when we're talking about this. You should definitely make sure that you're working with an expert who knows what they're doing. This isn't something that you take with tell the patient to take home and do this themselves, or do you?
No, we actually don't. We would rather be the person that's responsible for that. We know where to put it, how to do it, how much suction is enough, and so on.
And how long you need to put it on. So getting to that now, when would you not recommend cupping for a patient?
Well, certainly, and this one's going to sound like kind of the proverbial no-brainer. This is not done on the abdomens of pregnant women for the obvious. It does create a vacuum. It is a pressure, and while they may do it in certain cultures, but here we don't. It's
frowned upon.
Yeah, that's the no-fly zone. We don't do that. We also don't do it over major vessels or arteries. For example,
like the carotid artery,
absolutely,
you wouldn't
would
touch
not
it.
It's also not done over in the elderly who have very thin, almost paper-like skin. It isn't done there because in some
like near the hands, or
well, yeah, or maybe anywhere. Once the skin becomes very thin, like an onion skin.
Thin, okay.
Never over broken skin, skin rashes, heat rashes, anything like that. And we talked about in the beginning.
Never over a blister.
No. Or over edema, where there's swollen ankles or swelling and so on. And over open sores.
So this doesn't treat swelling?
No. I will tell you there's a type of cupping, though. We talked about one type was the sliding or moving cupping.
Right, almost like a massage.
Another type of cupping they do in China, we don't do here as much. But they'll actually take a flaming cotton ball and throw it in the cup and then place it on the patient. We look at that as a little bit of a risk factor, so we go,
so the flame, and then does it burn itself out inside the cup, so
but
it gets a little
little bit more heat produced there. We in this country generally it may be done, but it's not done quite as frequently as it is in China.
Now, what's the design of that? Why do they want to do that? What are they thinking they're
more suction,
getting
more
from
heat
that?
is generated. That's called fire cupping. The other type of cupping is called wet cupping, and this may be a little interesting. But we would take a sterile lancet, and since I don't have one with me, I'll just pretend this hemostat has got a little sharp point. We'll pretend this is a lancet.
Yeah.
And let's say a person had a lot of swelling around an ankle from a trauma, like a severely sprained ankle. This is not uncommon. To make a little puncture wound pattern, maybe 1 or 2 or 3 or 4, and then quickly adhere a cup to the area. Now the cup will fill with blood, and I will tell you, and this is going to be a little hard to grasp at first, the cup will generally fill if it's an old injury. So let's take a chronic low back pain, and let's save the ankle, and we lance it and place the cup over that. The cup will ultimately fill up quite frequently with a very dark black, almost a sludgy material with, I would say, the consistency of grape jello.
Fascinating.
And when a patient sees that, they have to do a double take. Like, did that really come out of my low back? And yes, it did. We talk about blood that's stagnant. It actually isn't bright red all the time. It gets dark, very dark, and it gets very sludgy. So
thicker material
is done to release that. And generally, when that's done and you get that result, you get a patient up off the table and they start moving. And most of the time, you get an oh my word.
They
I feel a difference already.
Feel a difference just what's been taken out.
For lack of a better analogy, it's like oiling a rusty hinge. And they get up and they move, and they usually say, "Oh my gosh, I can feel a difference already." Pretty nifty stuff.
Moving that out with the bad. Now, as far as when you do this to a patient, is it uncomfortable?
I would say 99.99% no. As long as it's done by someone who knows what they're doing. Now with a pump type, which I'll do on your hand, relax your hand,
all right,
and we're just going to pump until I get it and then let me see if I can slip this off.
Yeah, let me see if I can loosen it. Yeah, I didn't get quite the suction. Maybe we
let me
need that
just kinda-
smaller one.
2, 3, 4, 5.
See
Let's
if we
try
can
that.
kind of drill down.
That's
It's
not
not getting it.
gonna
Maybe maybe we can try the smaller
We'll
one.
give the small one a try and see if that one wants
See,
to
I
stick.
don't know
Let me put
why.
it more on your palm,
Yeah.
your thumb here.
A little bit of flesh.
Okay, don't
All right,
move a
I'm not
muscle,
gonna
and let me
move.
take it off. There we go.
There we go. I'm feel. Darn it.
Yeah, we'll get it. Was that uncomfortable though?
It was not, and I was trying to like not move to get it. And
Yeah.
no, it,
Well,
it
first
turns
of all,
a little discolored.
we normally wouldn't cup the palm of the hand, but that's
Right.
the easiest
But
access
that's the
point we
place
have
for you.
today.
Well,
But generally,
what about,
where
what
these
about
are done,
cupping here? Would that not be a good idea?
I wouldn't do it here just because you have a lot of vascularity there.
Oh, I see.
But generally, we're thinking about cups. Probably 80% of the time, they're on the somewhere on the back, because this is where we have a lot of stagnation. This is where we have a lot of muscle tension. We hold a lot of tension in our upper back, low back, and so on. And we have a lot of back trauma. So probably 80% you'll see in place there, and there's no pain involved with it.
All right. So the back most of the time. Sometimes a leg.
You can.
Fleshier,
Any large
upper
muscle
leg.
group. I've even seen them done in some clinics and classes where they'll do them on the temples or on the face. We look at that a little bit like, well, because one thing about cups, when you remove a cup, you do have a little purple circle. If there was an effective treatment there, you've drawn this blood up to the surface, and it is a little bit of a bruise. It isn't painful, it isn't tender like a bruise, but it looks like a perfectly circular, symmetrical bruise.
And how long does that stay on the body?
A few days.
A couple of days.
And we tell people up front. In fact, years ago on one of the red carpet shows, they had Gwyneth Paltrow, I think, was walking the carpet, and she had 8 or 10 of these perfect purple circles on her back. And one of the interviewers said, "What is that?" She goes, "Cupping." And she just kind of blew it off like nothing. Doesn't everybody get this?
Isn't this a common treatment? Very fascinating. And right now, we're going to send it out to East West College of Natural Medicine, and we're going to see a treatment using cupping with Dr. Brandon Fuller.
All right, welcome back to the college. I'm here with Dr. Brandon Fuller and his patient Amanda. He's going to demonstrate cupping. Take it away.
Thanks, Russ. So when we talk about cupping, we have to think back a couple thousand years and what the Chinese used to do. They used to take horns off of animals, and they would take a flame and place that flame in the horn and stick it directly on the body. So if this was a horn, they would put the flame in directly on the body, and that would help suck out necrotic tissues directly out of a festering wound. Right? This, in today's practice, we don't normally go down that route and you try and suck out necrotic tissues. Generally, we say, okay, you need to go to the MD and have that something surgically done with that, or get antibiotic injections, something of that nature. But what we do is we use these clear glass jars. These clear glass jars are used to help draw the fascia and draw the blood from the area out of somewhere where it's been stuck for a while. So patients who have chronic pain have this area of blood that's just not moving the way it should, right? So we might say, okay, you have this chronic pain right here on your lower back, and the blood's just not moving the way it should. That nutritious blood flow isn't moving. So similar to Tweenaw, what this does is, as it pulls the blood out of muscles where it's stuck, it helps also break up that fascial tissue that may have adhesion. So it separates the fascia from the skin and from the muscle. And pulling that blood out of that muscle where it's stuck helps this nutritious blood flow come into the lower back, right? Now there's many different sizes of cups, right? We have a large cup here, we have a medium cup, which I'm going to place on Amanda. And we have very small cups, so we can do different areas, right? Sometimes we want to place them on forearms, or we want to place them on calves, and we don't have a large enough area to where this large cup can stick on a calf and sit on a calf like it's supposed to. Now, sometimes you'll go to stores and you'll see different kinds of cups, right? Only a couple hundred years ago, rather than glass, they used sections of bamboo. And then now as plastic is becoming more and more available, we'll see plastic cups being used where you can suction yourself and you don't have to use any sort of flame, right? The beauty of these cups is that in a medical practice we can sanitize them completely, whereas plastic cups we might not be able to, right? So let's say we needle Amanda here, and then we place a cup after we've removed the needle onto the spot. Placing that cup, sometimes we'll draw a little blood out of where the needle was placed. This cup can be sanitized more cleanly and more purely than a plastic cup. One of the other benefits of these glass cups is that we can slide them. So with the use of a little bit of oil on the back, we can move this cup and pull that fascia away from the muscle and in between the skin, right? So we can help break that up and we can give almost this deep tissue massage. Now, cupping we've seen around all over the place. We've seen in the Olympics, swimming stars. We've seen different types of people from all over the world get cupping, and it helps heal the body. It helps bring healthy, nutritious blood. So why don't you come on in and give cupping a try in conjunction with acupuncture? What do you have to lose? I'll see you next time.
Thank you, Dr. Fuller, for showing us that, and don't go away because we're coming back with much more.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back. We've been talking about cupping, and Dr. Wrench, we just saw Dr. Fuller's demonstration, really gives a good look at how this works on a patient.
Yeah, and I have to say, Dr. Fuller, if you're watching this, you're smooth. Let me just say that. One thing I noticed, he's very good at this, it does require training, and when the students first learn this, they have a hard time with it. In the beginning, everybody does. But if we saw him and we look back at that, he has a cotton ball in these little hemostats right here. So
right, in the little scissors.
And then it's saturated with alcohol and a high percentage, usually 90% volume, so that it burns really hot. And then it's inserted into the cup, and if you look at that portion of the program, he swirls it around. This is warming the cup. Now remember, a cold glass placed on your back unexpectedly
gets a little bit of a
rise
shock.
out
Yeah.
of you. So it's a warming effect, maybe very fast, once around and placed. It needs to be brought very close to the proximity, and we can see this on camera. I'll keep it near my knee here, but it would be very close proximity, swirled around
It's
once
almost
or twice,
one motion.
and immediately you let go of it, so that the cup can draw the skin up into it. If in the event I warm the cup and press it down hard, my skin becomes taut and cannot enter the cup.
And can't come in.
Like the head of a bongo drum. It can't rise up into the cup.
I see.
So we get greater suction by warming, releasing, and just letting it sit there. And you notice he does have a very, very refined technique. He's done lots of years of cupping, and it shows that good technique always makes for a better treatment.
Outcome and
Absolutely.
a better treatment. Now, we all remember Michael Phelps competing in the last Olympics. He had all those marks on his upper back, those cup marks, I suppose they were. And is it something that athletes, not just him, but others do a lot of?
You know what? They do more today than ever before. And certainly we talked about Gwyneth Paltrow, we talked about. Now we're talking about Michael Phelps. And he wasn't the only one, as I recall, at those Olympics in particular that had all these marks on their backs.
There were others.
And that created such a media storm. People were going, oh my God, what is it? Well, it's either he was attacked by a sea monster or he had cupping.
Right.
And we're going to opt for the latter. But he's certainly a guy, like a lot of people, that bring it out in the forefront and people see it and go, why is he getting it? Why is he getting it? Because it works. These guys work out so many hours in a pool all day. They're at the top of their sport.
Yeah.
They're the peak athletes in the world. And these guys ache. They train, they get sore, they've got lactic acid accumulation, achy muscles.
Now, can cupping redistribute the lactic acid dosage?
Well, it speeds up two things. It can help the body assimilate and absorb and move lymph and blood and so on. It helps with the flow of these things. So it's like a flushing effect, if you will, through the body.
Yeah.
That's why so many people do it. We talked before about Tom Brady, who has a clinic. Tom Brady gets, if we don't know this, we should, gets regular acupuncture. He gets cupping. He's a fitness fanatic, and it shows.
So football season's coming up. It's a good share of these, even college athletes, not just the pros. This is something that you can do.
This has been around for so many thousands of years, and today when people see it, they go, oh my God, it sounds barbaric.
Something new.
This is such a no big deal thing, and it's such an effective therapy that people that are what we would consider the intelligentsia now, people in the know, are all getting this. But it's been going on for thousands of years. Anyone can do this.
And it's not harmful. I mean, you see that mark, but that mark goes away.
Yeah, not at all. And those marks aren't painful. But that's a good sign. We look at an area of discoloration after a good cupping treatment, and we almost high-five each other.
That's almost a good thing.
It's a good sign because that's indicative of the stagnation present in that tissue.
That you were able to change.
Absolutely.
By the cupping. Now, are there other forms of cupping besides using a flame to create this vacuum that you talk about?
Well, we showed you the pumped type.
Right.
One thing
On
I
your
might
hand.
mention that could be dangerous about that, if I was doing that on, say, your upper back, and I'm pumping it, and I'm not watching the skin move into the cup, I could do it too much to the point where it's uncomfortable. And so we want to stay always within the patient's comfort zone.
So you're not touching the pain receptors. You're going right before you get to any sort of pain.
Pain receptors feel almost everything. If we're touched, they feel it. What we don't want you to do is we don't expect you to operate outside your comfort zone. This medicine isn't punishing, but there's one type that's a small rubber suction cup, and certain people that specialize in facial rejuvenation use this, and they'll put an oil that's very therapeutic for the skin and the complexion, and they'll squeeze these little cups, place them on the skin, and then release them, and by opening it up, it creates a very, very mild vacuum. And people, again, that specialize in this, it's a type of facial. They slide it all around the eyes and the little crow's feet and the wrinkles as a type of rejuvenation of the soft tissue.
Dr. Wrench, we're almost out of time. Let's tell people where they can go to get more information about the college, about cupping. Where can you send them?
Well, we're at East West College of Natural Medicine in Sarasota, where we've been for 20 years. You can call 355-9080 and ask for our clinic desk. We'll answer your questions or we'll make an appointment for you.
And thanks for joining us. We'll see you next time.